Community Services and Health is Australia's largest industry group, employing nearly 12% of the national workforce. Over the next few years, our care industry will undergo important changes on a scale we've never seen before. We'll be responding to challenges of increasing demand for services, major restructuring of service models, and a reduction in funding growth. By identifying workforce development needs and creating new job roles, we can better prepare for the challenges ahead and ensure that all Australians can access the right care for a good quality of life. Let's take a closer look at some of these issues. Increasing demand. These days, we're all living longer, but it does place pressure on care and support services. Last year, nearly 250,000 baby boomers turned 65. By 2024, 25% of the population will be 65 plus, and 1.1 million will be over 85. Most care workers themselves are mature-aged, with the average of aged care nurses now 48.5 years old, which means in another 20 years they are more likely to be receiving care than providing it. With an ageing population, care needs increase due to conditions like dementia, diabetes and heart disease. Multiple chronic conditions also become more frequent. Nearly half of people over 65 have a disability, and this is even more likely after we turn 85. As a result, the national demand for carers will increase by at least 40% in the next 5 years. Some predictions are even higher. A second challenge is the restructuring of our service models. Government reforms are changing our industry. These changes give individuals a greater choice in what services they receive and how they receive it. This will lead to increased employment opportunities for people with transferable skills in aligned sectors like aged care, disability and mental health. We'll also rely more on qualified vocationally educated and trained workers as part of a healthy workforce mix of both vet qualifications and higher education. Workers will need more practical skills with case management, care plans and financial management, while managers will need more advanced leadership and management skills to support staff who'll be working in a greater variety of locations and environments. Another challenge is reduced growth in federal and state government funding. Although public spending in most areas has increased, future funding growth will be constrained with a focus on key priority areas. As the largest and fastest growing employment sector, the care industry will need to focus on sustainable workforce development to manage the increasing demand. To support new and changing job roles, qualifications need to be adapted quickly and efficiently in response to industry changes to match the skills most in demand. These realities represent a fundamental change in how Australia will deliver and manage health and community services in the next 5 years and beyond. So what action can we be taking? What needs to be done? If you're a policymaker, manager, trainer or worker, you have a role to play in helping determine Australia's future services by defining how care is delivered and helping develop the workforce to deliver it. Find out what you can do by visiting CS&HISC.com.au and reading eScan 2013, A Time for Action.